Well, hello, Jacob, and thank you for agreeing to come on again today and discuss some of the final questions. And thank you, everyone, for joining us. I hope you're getting a lot of information. I know I am. Again, I'm Karla Robeson, and this is Dr. Jacob Minang. So, Jacob, when we ended up last time, we were discussing the effects of the COVID-19 disease and vaccines on issues like pregnancy and fertility. And one of the things that we hear that is clearly not valid is at first we were hearing that children don't get this. Well, that's not true. There have been many children who have tested positive, some more severe than others, and there are children who have passed away with this disease. Can you please talk about how COVID-19 affects children and whether that's vastly different from how it affects adults, or is it all based on individual immune response?
Okay, a pleasure to answer that. So first of all, debunk the myth about a certain group of people not being infected. The relationship between viruses and other infectious agents and humans boils down to having target cells and receptors. So long as we share the same epithelial cells with our younger ones, so long as we have the with the younger ones expressing the receptors that allow them to take in the virus, they will be infected. So being infected, every human being can be infected. There's no question about that. Even the studies are talking about people with certain blood types being protected. That protection is talking about what happens to your body after you get infected, not about the ability of you to get infected. And so, and that next step now, it's something that immunologists refer to as immunomodulation. That just means the body's ability to control an immune response so that it does exactly what it has to do and then shuts down. And that's where the difference comes in. We get better immune responses the older we get until we get into our mid-40s. Then our immune responses start getting weaker, like with everything with the entire aging process. That's why the elderly are the ones that tend to die first, by the mere reason that they are older, not because of any other complications that might happen to anybody, but for the simple reason that they are older. So they're infected like the children, but they already have aged immune systems. The other thing is immunomodulation. We human beings, we differ in the way our genes work when it comes to controlling an immune response. So even within children of the same age group, because all children can get infected, most children control it well because they already have better immune responses. But some children, despite being able to control the virus, end up succumbing to the symptoms post-clearance of the virus because their immunomodulatory mechanism that they inherited from their parents are not as good as that of other children, but because they have other underlying problems like asthma, diabetes, weight issues, and things like that.
So really, it's not just the immediate immune response that affects this, but the immune modulation that you were talking about,
right,
where your body knows how to respond and attack something that's foreign and then back off so that you don't go into an over response.
So immunologists look at it like this. They were literally swimming through microbes our entire day. But most of the time, some of those microbes are mere annoyances. Our body is responding, but we're not even noticing, we're not even having a chill. But a clear sign that you're having an immune response sometimes is when you at least have a little chill or a little fever or a little temp and then it disappears. Trust me, you just encountered some foreign body that your body reacted to a little bit. A lot of times, the things that are out there, we've already built a symbiotic relationship with which we don't bother each other, like a lot of the microbes that live in our gut. They are foreign, but we have built a good relationship with them over millennia that is beneficial for both of us. They have enzymes that help us break down some of our food. We give them some of the extra food that we don't need, and everybody's happy, go lucky. Okay, but so you're getting immune responses to a ton of things out there, but you're also controlling the responses to make sure that they're not exaggerated, that they're only as good as it takes to get rid of the organism. And for some organisms, your body decides, well, actually, it's fun for them to be around. I'll keep them around so long as their numbers are not too high. When the numbers are trying to be a little bit excess, you get a little bit of stomach in the case of the gut, or you get a little diarrhea there. And then as soon as you've controlled their numbers down to reasonable levels, the immune system shuts down. Anything beyond that, that is immunodysregulation, and then your illness is arising because your body is having an exaggerated response.
Okay. So considering these responses, when you get this vaccine, if I were to get the vaccine, I'm an older adult. Right. You are a younger adult. Could I expect to have a more significant response, or is that completely individualized?
Okay. So the beauty about vaccines is that they are very targeted, they're very specific, and they usually use only one or a couple of molecules. Imagine a very large virus that if that virus infects you, is going to swarm your system with a ton of viral proteins that you're going to be generating immune response to so many targets in the virus that are not even important for the survival of that virus and swarming your system, as opposed to a vaccine that brings in just a single target from that virus and the most important thing that can prevent the virus from infecting you. You're going to get a response that is much more muted with the vaccine compared to the response to the virus. And but that response is not only muted, the beauty is that response is actually a lot more important than the response to the whole virus because it's very targeted. Okay. It produces antibodies that will be able to target just the spike protein that is what helps the virus to get in your cell. And so the virus will never be able to get into your cell. And that's why you don't worry about using the vaccine even for the elderly that have slightly weaker immune responses, because they will be able to generate a response to something that is more targeted, is smaller, and is not going to overwhelm their body. That's a beauty.
What could I expect as side effects? If my doctor says, Karla, you need to go get this shot, I go get the shot. Yeah. So what could I expect?
Right. So the side effects that you're going to get are going to be twofold. There's going to be side effects that have to do with the other things that we added in the vaccine to be able to keep it stable, and those are referred to as excipients. And that you can call more like, you can refer to as an allergic reaction, because some people react to different things. But then there's a second side effect they're going to have, which for immunologists, we are excited to find out that you have that side effect. You're going to have maybe a short period where you're going to have a swelling around the injection site. Okay. You might have a little bit of temp and a little bit of fever for a couple of hours, or maybe last a day or two. For the average person, the side effect for the immunologist is proof that your immune system recognized that virus and generated a response. It's proof that the messenger RNA actually got into cells, and the cells were able to produce viral proteins that your immune cells, T and B cells, actually recognized it as foreign and generated an immune response. That led to some inflammation at the site of injection and some fevers for a day or two. The immune system is very excited. That second response that I'm referring to should get even stronger when you get the second dose, because that first dose is called a priming dose. It's just telling the body that there's something out there. The second dose you get about a month later is called a boosting dose. That response that you got with the swelling should get a little bit worse. The chills should also be a little bit worse and last a little longer. But it's nothing that is fatal. It's just telling you that, oh, your body is really recognizing this thing and producing an immune response. That is very different from if you were allergic to the excipients, not the actual vaccine component, but the other things that have been included in the mix to keep it stable. And then an allergic reaction, of course, will get worse the second time and can lead to anaphylactic shock and could kill you. And in which case, they tell you that if you know that you're allergic to vaccine before, then you want to be in a hospital setting when you're taking your second dose. Be prepared to stay there for at least an extra hour so you're monitored. And if you're fine in that first hour, then you're fine.
Oh, okay.
Allergic responses.
Yeah. So the side effects are something I really want, because that shows that my body is.
Side effects. If you are part of a clinical trial, the way you know you're giving a placebo is when you don't have any chills. That right, they know to just give you water.
Okay. Now, one last question here. We've seen many people with COVID have some pretty significant long-term effects. Is there any standardized set of long-lasting effects from COVID that can be identified yet?
Not really. Again, because this virus is very new to us, like most other things, it's going to take so many years. to be able to track down effects. So the only thing that has been clearly defined now are symptoms of the virus. And it's taken us 10 months to know that, okay, when somebody is infected, we can tell that they have a dry cough, they have difficulty breathing, they might have issues with their heart rate and all of that. That's just symptoms that you're infected. But as for the destruction on your body caused by the infection, which we know that destruction is actually caused by an elevated immune response, it varies with individuals and depends on how long they were sick before they cleared the virus. A lot of people are sick several months after they've actually cleared the virus because the immune system just keeps going and going. And that's why steroids are part of the cocktail, because steroids are very
Okay.
on the immune system.
Can reduce some of that swelling, I'm sure. Yeah.
So it's going to be a
Wow.
number of years studying different age groups and looking at symptoms that are specific for people that have different underlying conditions, depending on how long they were sick before they cleared the virus, if they survived.
Wow. Well, Jacob, this has been really an informative series, and I think you've answered a lot of questions that many of us have had that we're not really sure who to believe. When you hear it on the news, it tends to be sort of dramatized, not just simple facts. And thank you so much. I greatly appreciate this, and I'm sure everyone else will too.
Thank you, Karla. It was a pleasure.